Chapped lips, cold feet, or stinky breath could be your body's way of telling you something's not right. Here are a few sneaky signs that you may not be as healthy as you think. According to Johns Hopkins Medicine, a quarter of Americans snore on a nightly basis. While this may seem like a sign of deep sleep, it could point to a more serious issue, and one that many people are born with. One common cause of snoring is a deviated septum, which means that the cartilage located in the center of a person's nose is skewed to one side.
Man, that septum is deviated, huh?
Many times, it's not even noticeable until someone begins snoring. As sleep specialist Dr. Daniel Rifkin explained to Health Digest, when the septum deviates to one side, it creates an uneven airflow through your nasal passages. That turbulent air can rattle the nasal tissue, resulting in snoring. If you find that your own snoring is waking you up or even causing you to still be tired during the daytime, it may be time to see a doctor. Snoring can sometimes be associated with high blood pressure, obstructive sleep apnea, and other health issues that warrant medical attention. Trauma to your skin may result in a bruise, but if you find you're getting bruises more often than not, there may be a cause for concern. Registered dietitian Ella Devar told Health Digest, when they occur too often or too easily, they can be signs of an underlying nutrient deficiency. Luckily, there's an easy fix. Simply adding vitamin C and K into your diet can help. These are essential when it comes to creating more collagen in the skin and strengthening the blood vessels, which means they'll be less likely to break and produce a bruise. To keep bruises at bay, Devar recommends eating vegetables, fruits, and berries daily. Eating foods like seafood or dairy that contain vitamin B12 can also help.
What bruises?
If you're still seeing black and blue even after upping your intake of these vitamins, there could be something else going on. Board-certified dermatologist Dr. Suzanne Friedler warned, liver disease and certain cancers also increase the risk of bruising. If someone suddenly starts bruising more than usual, it warrants seeing a doctor. We've all had an itch we just can't scratch. While it may seem like no big deal, Dr. Friedler explained, itchy skin can also be a sign that something funny is going on.
It's not funny!
Itching is often an indication of dry skin, so Dr. Friedler first recommends using a moisturizer for relief. It could also be helpful to take a look at what's around you if you find you're frequently itchy. Allergic reactions, even if you don't have a visible rash, can result from medications, bug bites, or simply something that rubbed against your skin. If none of these reasons seem to apply to your situation, turning to a dermatologist is the best way to go. Something more serious could be going on. Dr. Friedler cautioned, itch can be a symptom of a low thyroid, severe kidney disease, or even cancer. A simple blood test can help rule out any of these long-term itchy issues. According to podiatrist Dr. Peter Lovato, there are people who have cold feet in the winter, of course, but cold feet in summer could be a sign of vascular disease. Vascular disease occurs when plaque builds up in your arteries. This blocks blood from being able to flow to different areas of the body. Podiatrist Patrick McEnany explained, eventually, the parts of the body that are not receiving the blood will get colder. And if your feet change color when you're feeling chilly, that's a sign that you should see your doctor. Another explanation for cold feet could be a lack of iron or vitamin B12. These help carry blood cells throughout the body. Without them, according to Devar, your body will divert blood and prioritize the most vital organs like the heart, brain, and digestion, which leads to coldness in extremities, hands, and feet. This often happens to people who avoid animal products, like vegans, as well as dieters. We've all experienced that feeling when your clothes are suddenly too tight and you just don't feel your best. You're bloated, and nobody likes that.
The menu's all pasta and he's so bloated.
Many people blame bloat on whatever they're eating, but if you're bloated all the time, it may be your body's way of telling you to reach for more water. Registered dietitian Gabrielle Taffer recommended, watch for signs of dehydration to combat the bloating and restore balance with adequate hydration. When you're lacking water, your body retains the liquid that it does have, and in turn, makes you bloated. In addition, the electrolytes in your body could be out of balance. Luckily, there's an easy fix. Taffer explained, this can be done with the consumption of water-based beverages with added electrolytes. Cucumber water or coconut water does wonders. It's easy to get annoyed by an occasional eye twitch. Usually, eye twitches are your body's way of telling you that you need a lot more sleep. However, if you find them happening more often than not, it may be time to talk to your doctor.
You have to help me with your fans because they were a little worried about you. They saw this video of your eye twitching. Are you okay?
You mean this one?
Dr. Andrea Paul, physician and medical advisor to Illuminate Labs, said they could be a sign of multiple sclerosis in rare cases. Multiple sclerosis is a disease that affects the central nervous system. According to the Mayo Clinic, in MS, the immune system attacks the protective sheath that covers nerve fibers and causes communication problems between your brain and the rest of your body. That said, it's important to examine all the underlying causes that could be contributing to your eye twitch. Dr. Paul warned, people concerned about recurring eye twitches should speak to their doctor rather than try to diagnose it online. If you find yourself constantly digging through your purse or pocket for some lip balm during the dreary winter months, you may not think twice about it.
Oh, Bruce, your lips are terribly chapped.
However, it could be more than just the dry air that's causing your chapped lips. The sun, spicy foods, and even wearing long-wear lipstick can cause cracking in your lips. Devar added, cracked lips can also reveal a vitamin deficiency. If you want to curb dry, cracked lips, Devar recommends a diet that includes iron and zinc. These can be found in veggies, nuts, legumes, and modest amounts of seafood and meats. For relief between mealtimes, Dr. Friedler recommended, start off by treating your lips with a rich ointment lip balm with SPF. If your lips don't improve, a dermatologist can help. Many of us banish bad breath by popping a mint, but we may just be masking the cause. Oral surgeon Dr. Jacqueline Tomsick advised, proper and routine dental hygiene are the first step. In fact, around 80% of bad breath is due to an issue in our mouths.
Why did Bernard get you toothpaste and mouthwash for Christmas, babe?
Because he told everyone my breath is rancid.
Bad breath can also be a sign of dehydration. When you're not drinking enough water, the bacteria in your mouth becomes unbalanced. That means you may need to find a way to rid your mouth of it instead of just reaching for a breath mint. In addition to drinking water, another way to help your mouth feel fresh is with probiotic foods. Taffer recommends reaching for things like kombucha or kimchi to combat bad breath. If you still find yourself with stinky breath after changing your diet, there could be something else going on. Taffer said, if this continues, it is important to see your doctor, as this can indicate oral thrush or something else that may need correction with an antibiotic. If you're always sweating, it could be your body's way of telling you something serious is going on. According to Peter Lovato, excessive sweating can be a sign of an overactive thyroid or an early warning sign of a heart attack. It could also point to conditions ranging from menopause to tuberculosis, according to the Mayo Clinic.
You want a definition of hell? Try opening a 400-degree oven while you're having a hot flash.
When it comes to perspiration, there are a few warning signs that we should all watch out for. If you find yourself feeling nauseous, lightheaded, or have a headache coming on, these could be a cause for alarm. Suddenly becoming sweatier than usual may be another indication that it's time to see a doctor. Although sweating isn't usually a cause for concern, it's better to be safe than sorry. If you find yourself dozing off during the daytime, you may need more sleep. Dr. Rifkin advised, it is common that fatigue and exhaustion are perceived as daytime sleepiness, when in fact they are very different. Daytime sleepiness could mean something else is going on. A simple explanation could be the fact that your diet isn't as balanced as it could be. Eating an adequate amount of fruits and veggies can give your body the micronutrients it needs to sustain energy throughout the day. Taffer recommended, green tea can be a wonderful addition to any diet at most times of the day to provide a bit of antioxidants, as well as a minor caffeine boost to get through that midday slump. If you still can't decipher the cause of your drowsiness, seeing a sleep specialist can help. Something like obstructive sleep apnea, a condition in which your airway becomes blocked while dozing, commonly causes people to feel drowsy during the day and could be the reason you're not feeling rested. An occasional white coating on your tongue may not be anything to worry about. However, this change in your mouth is your body's way of telling you something is going on. Dr. Paul explained, the white coating on the tongue is due to a buildup, a bacteria, and/or fungus. There are a few reasons why this could be happening. Dehydration, which is one of the most common, can cause cracks in your tongue, providing a spot for bacteria to easily build up. Or, according to Dr. Tomsick, a white tongue can also be caused by smoking. While it's always good to add some extra water into your diet, there's an even better way of helping get rid of this white coating altogether. Dr. Paul shared, the best way to treat this is with manual removal using a tongue scraper dental device, along with mouthwash. Dry eyes are enough to dampen anyone's day. Unfortunately, this is an issue that's even more common as we get older, due to our body's decreased ability to create tears. However, eyes that feel constantly dry can eventually cause permanent damage, so it's important to diagnose dry eyes right away.
My eyes are flame.
While there are medications to treat dry eyes, other medications you're taking could actually be the culprit. According to Dr. Paul, there are medications that can cause dry eyes as a side effect, like some antidepressants. For even more protection, the Mayo Clinic recommends giving your eyes a break while working, using a humidifier, teardrops, and even moving your computer screen to a lower position so you won't have to widen your eyes to see what's on the screen. If you're drinking an adequate amount of water yet still can't seem to quench your thirst, your body could be telling you that something more serious is going on. Devar warned, dehydration is the main sign of early diabetes. How exactly does this happen? Well, when your body isn't creating enough insulin, a simple sugar called glucose begins building up. This chemical creates the urge to empty your bladder more often, and in turn, you'll want to drink more liquids to make up for it.
I'm so thirsty.
However, no matter how much you drink, you'll still be feeling thirsty. If you find that drinking more isn't helping, it may be time to visit your doc. DeVar advises us all to watch for extreme thirst and the excretion of an excessive amount of diluted urine when it comes to deciphering your excessive thirst as a sign of diabetes.